peer support services, it is an evidence-based model of care. And it's basically people who have lived experience with mental health or substance use disorders or both. Those individuals are typically in long-term recovery, go through training, and they mentor or support people with similar issues.
This episode is sponsored by TherapyNotes, therapynotes.com. Be sure and check them out, and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Hello, everyone, and welcome to the podcast. And this is episode number 306 of the Practice of Therapy podcast. Hi, I'm Gordon Brewer. Glad you've joined us, and almost happy Thanksgiving, or happy Thanksgiving as this particular episode is coming out the week of. And it's hard to believe that the holiday season is already upon us. It just seems like it snuck up on us out of nowhere, which it always seems to do. But anyway, looking forward to you hearing my conversation in this episode with Kurt Schmidt. And Kurt is the founder of the Peer Network, and looking forward to you learning more about that. Most of us who have been around a while are pretty familiar with peer support specialists, and particularly if you've worked in the addiction recovery fields and that sort of thing, you probably hear a little more about it there. But there are also mental health recovery peer support specialists, and it's a really needed service, and I think it's probably one of the most effective ways with helping, particularly with people with addiction, and being able to find someone that knows what it's like and has lived the experience of recovery. And so Kurt's going to tell us more about that. The other thing I love about Kurt and the Peer Network is that they are the newest sponsor of the Psychcraft network. So you're going to be hearing more about them. And so I'm looking forward to this introduction and hearing my conversation with Kurt about the Peer Network. And we're going to dive into that here in just a moment. But before we get to that, one of the things I'd love for you to do is I've got an upcoming episode, and we're going to be talking about JotForm. And JotForm is a company, or is a platform that can help you create pretty much any sort of form that you can think of that you would want people to fill out online. And in particular, it's important to know that you can make it HIPAA secure and HIPAA compliant, as they say. And so we'd love for you to check out more about that, and just simply go to practiceoftherapy.com/jotform. And from now until November 27th, 2023, they've got their Black Friday sale going on, and you can get 50% off their services by checking them out. I know there are a lot of clinicians out there that are using JotForm. It integrates with so many other different platforms like Google Workspace and those kinds of things. And so I invite you to go check it out, and you're going to get to hear from Morgan Zients in an upcoming episode. So you can find out more about that here in a couple of weeks. But anyway, I invite you to go over and check out JotForm and become familiar with it. And again, you can go to practiceoftherapy.com/JotForm. And also, one other thing is we're getting getting close to the holiday season or in the holiday season and all the sales that are going on, I'd invite you to go over to Mental Health Wear. And you can get to that by going to practiceoftherapy.com/mental health wear. And if you've been listening to previous episodes, this is a partnership or a collaboration I'm doing with a friend of mine around an online store that is creating print on demand t-shirts, sweatshirts, also accessories and other swag around the mental health and recovery niches. And also I know that she is also having a Black Friday sale, and you can get 20% off anything in the store from now until November 30th. So if you'll go check that out, practiceoftherapy.com/mental health wear, and check out all those great items there that she's got. And also she can do some customization if there's anything that you see that you want to tweak a little bit, or if you'd like to add names or give things as gifts, be sure and check it out. And that's, again, practiceoftherapy.com/mental health wear. So be sure and check it out. And also here, before we get to my conversation with Kurt, I'd love for you to find out more about one of the members of the Sightcraft Network, along with some more information from our sponsor, TherapyNotes.
Hey there, I'm Aaron Potratz.
And I'm Nathan Hawkins. If you don't know us yet, we're the host of the Shrink Think podcast, which bridges the gap between therapists and clients.
The Shrink Think podcast is proudly part of the Sightcraft Podcast Network, focused on helping people live more meaningful and productive lives.
Join us every Wednesday in our engaging, informative conversations and lighthearted humor to help you normalize and demystify therapy for those beginning or continuing their mental health journey.
We discuss everything from understanding styles of therapy to addressing conflict with your counselor, learning about attachment styles, and the fear triangle. We seek to run the gamut of topics to pull back the curtain and empower effective therapy.
If you haven't listened yet, you can find us at shrinkthink.com/podcast and discover other resources, including educational videos and fun swag at our swag shop.
Have you ever wished your private practice could run as smoothly as a well-oiled machine? Well, look no further, because TherapyNotes is here to revolutionize your practice. TherapyNotes is the complete practice management system you've been dreaming of. With everything you need to manage patient records, schedule appointments, meet with clients remotely, create rich documentation, and handle insurance billing, it's your secret weapon for a smoother practice. And the best part? It's accessible wherever and whenever you need it. Yep, even on the go. Imagine having more time for what truly matters, your clients. It's like having an extra set of hands, but digital. And here's the kicker. It's the very EHR Gordon relies on in his own practice. So, you know it's the real deal. Say goodbye to paperwork nightmares and hello to more time and better quality care. Check out TherapyNotes today at practiceoftherapy.com/therapynotes. Oh, and don't forget to use the promo code GORDON to get 2 months free. That's practiceoftherapy.com/therapynotes with the promo code GORDON. Enjoy the show.
Well, hello, folks, and welcome again to the podcast. And I'm really glad for you all to get to know Kurt Schmidt. Welcome, Kurt.
Thanks, Gordon. I'm really excited to be here.
Yes, and Kurt and I had a conversation a little while ago. Kurt had reached out to me just about, just kind of getting some ideas about our space here in the mental health field. And Kurt is a person that is, you correct me if I'm saying this wrong, Kurt, but certified in training peer support people for addictions. Have I got that correct?
Actually, the training part, not so much, because we can get into that a little bit, but I am a certified peer support specialist here in Missouri. And I also have my LMSW here in Missouri as well, but I am a peer support specialist. It's kind of how I got into the field, and
Mm-hmm.
it's, something I'm really passionate about and excited to talk to
Awesome. Yes.
today.
And yeah, and I probably jumped ahead a little bit, but Kurt, as I start with everyone, why don't you tell folks a little bit more about yourself and how you've landed where you've landed?
Sure. So, unlike a lot of people, I didn't start my career in behavioral health. Most of my experience over the last, 15 years or so was outside of that field. After college, I went to Purdue University where I got my undergraduate in business. I actually went to culinary school after that, and I worked in the restaurant field for a while. Lived in Chicago, Florida, eventually kind of got out of the restaurant side of things and got into more healthcare and corporate food service, where that's kind of where the majority of my career kind of went. And that's really where I kind of started my journey in recovery, which is a big part of my story. Most people probably know the restaurant industry and food service wasn't the most conducive industry to recovery and sobriety.
Mm-hmm.
So, it kind of forced me in a different path in that field, which I was grateful for. But really, the seeds were planted for me in my mid 20s when I was a chef working in restaurants about moving forward on that path. Eventually, I kind of moved up the ladder in that field, getting out of the day-to-day cooking and food service and got more into management and directing accounts and things like that. And then, COVID kind of hit. And
Mm-hmm.
also, too, at the same time, I was dealing with a sick father who struggled with addiction most of his life, and, ultimately ended up passing away a couple years ago from it. But, at that time, COVID hit. I was at that time had transferred out of food and got more into technology and supply chain. So that was kind of a big transition. But then I started to really reevaluate, what I wanted to do. Everyone was kind of forced to be home. I had already kind of had a community in recovery and support, but hadn't made the leap into that as a career. And I talked to a friend of mine who is a therapist and a psychologist, and kind of explored like what that would look like. And that's when I learned about peer support. I had never heard of it. He actually mentioned to me, and I started doing some research and thought, okay, well, if I'm gonna do something different, it's a good segue into getting into the field where I can get some experience and then go back to school maybe and get my MSW.
Mm-hmm.
So I did that, and I went through the certification process here in Missouri, found a job with a local, I wouldn't say local, they're in 3 states in this area, as a peer support specialist while also attending school full-time for my MSW. So it was a good way to get my feet wet in the field. But what I found is when I started doing peer support and working with individuals who are, mostly in kind of the pre-contemplation stage of change for that in that organization, is that I loved it. I could share my own experience, kind of model, the behaviors that, that we want others to kind of emulate and show that there is hope, through my own experience. But, the only issue with that was, and this is what kind of led me to start my business, the peernetwork.com, was that those positions are grossly underpaid, and there's not a lot of opportunities for career growth within that field, which was disappointing because there's a lot of good peer support specialists in the field that have been doing this for years, but ultimately end up having to pursue other licenses or credentials just because the pay for those positions, it's just, you can't really support yourself or a family. So hopefully I answered that question in a roundabout way. I
Yeah.
think I jumped around a little
Yeah,
bit.
well, no, that was great, and it's quite an amazing journey. I think what's interesting is you were in a totally different career before you moved into this kind of work. I can that resonates for me. I don't know if I've shared how much I've shared this, but I was before I went back to graduate school or went to graduate school, I was in the funeral industry for a long time. And so
Oh,
just
okay.
making that transition was quite a transition. So, but yeah, I'd love to. I know I don't want to get too far off on a tangent, but I'd love to
Sure.
talk food sometime. But
Definitely.
yeah. So, but Kurt, maybe for folks that are listening that might not be quite familiar with peer support specialists and that sort of thing, tell more about that and what that involves and what they do.
Sure. So peer support services, it is an evidence-based model of care. And it's basically people who have lived experience with mental health or substance use disorders or both. Those individuals are typically in long-term recovery, go through training, and they mentor or support people with similar issues. So
Mm-hmm.
basically it's leveraging the peer support specialist's own lived experience to kind of break down some of those barriers for clients so they can share their own lived experience and relate at a different level that's kind of unmatched, right? Because the
Mm-hmm.
person providing the support has been there and kind of walked in their shoes. Now, I just want to kind of be clear there. Peer support, some people think of that as, if you think of a 12-step program or something like that, a sponsor, and it's not that, right? The certified peers go through training, and it does kind of vary by state, and there's different levels that you can pursue, but they are trained, in ethics, different interventions like motivational interviewing. They understand professional boundaries, personal boundaries, things like that. So it is different. Yeah.
Yeah. Yeah, I've become a little bit familiar with it in working with some folks that are, I'm not, I don't consider myself a recovery specialist or really that being
Mhm.
necessarily my niche, but I've worked with some people in the past that have gone through the recovery process and then, are in recovery and then what get really interested in becoming a peer support person. And yeah, it was interesting to find out, most people don't know about it, that at least in my state, that they had that whole program.
Yeah. And, I have a lot of people reach out to me asking about it. And I kind of refer them to their state because that's the first step and typically, going through that process. But yeah, it's, I think a lot of people early in recovery tend to think that they want to become a peer support specialist, which is great. But that's also, can be kind of a slippery slope. Like for my organization, all of our peers are nationally certified and they have a minimum requirements for hours providing the services. Most of them are in long-term recovery, 5+ years. So it's important, to make sure if people are seeking out those services that you're working with a peer that really has been there and understands and has been doing it for a while,
Mm-hmm.
because you don't want someone that's helping another person that's still, really struggling themselves. So
Yeah. Yeah. How do you, this might be, I'm sure it varies from each person, but how would a person that was maybe in recovery determine if they were ready for it or not? And I know that's kind of a broad question and there's no exact answer to that, but what would be some things you would think about?
think about, where a big part is where they are at in their own recovery journey. I mean, I don't necessarily think there's a time frame per se. I know some organizations that do provide the training for states require like an attestation saying I've been in recovery for a year, or, some sort of time length requirement. I think the person really has to make sure that they themselves personally are healthy, happy, working toward their own goals, and in a position where they can really offer that support. Because recovery is not a one size fits all or a linear process. It's different for different individuals. And I think if you're going into it for the money, it's not there, at the moment. So it's really got to be a passion and a desire to help others. Now, if people don't necessarily want to do that as a career, there's other ways to help others and not necessarily make that their full-time career. But I think it's, to answer your question, Gordon, I think the person considering that as a career path has to be in a really good place themselves, because you can't help someone else if you're still struggling. And that's kind of a ambiguous answer, I know, but I think the individual, it's different for each person, and that person, has to do some soul searching. I would suggest, maybe talking to a peer who works in the field and understanding what their experience was like and what led them to get in the field, or if maybe they have someone they kind of look up to that does that, talking to them and seeing if it's a good fit. And that's something I can share my contact info here. I'm always happy to talk to people about that, because I think we need more peers. And I can, later on, I could maybe share some stats, but, there are significant improvements of quality of life, all kinds of things when peers are involved in someone's recovery. So,
yeah, it's that whole concept that I'm a big believer in, of having a community of support around you, and whatever adversity a person is going through in their life. That's just such an important piece. And, whether it's dealing with a physical illness, or even, of course, mental illness, and then certainly addiction, having those people that can support you along the way is I think crucial. And I'm one of those have to kinds of things, at least in my mind. I mean, a person can't just go through it alone.
Definitely. And I think that's the benefit, right? When you're working with someone who's been there and has the lived experience, it removes those feelings of isolations, because you can connect to somebody who's been there, and also it does provide a sense of hope, because you see that person has been successful in recovery, and that it's possible. And too, Gordon, I with my LMSW, I do work at a small private practice here in Missouri, and as in like a therapist or counseling role, we're kind of steered away from sharing our own lived experience. The self-disclosure part is, I think people have different views on that. And I don't really share that unless someone asks, because I'm not going to lie. And that's, but in the, peer support, that is kind of the strength of that relationship, is the lived experience. So.
Yeah. Well, I think it gives, and this is, people have heard this from me before here on the podcast. I really, I think being a kind of a blank slate therapist is not that effective in the long run. And I think when we can share our own experiences and do a bit of self-disclosure, it gives us more credibility with clients, I think, in that.
Definitely.
Yeah. And it also makes us more accessible, builds the rapport that's essential, and that whole relationship, clinical relationship, just gets enhanced, I think.
Yeah, I completely agree. Yeah. And like I said, I think some people, depending on who you talk to, some people have different views than that, about that.
Right. Right. Well,
But I agree.
yeah, yeah. Well, to change gears just a little bit, Kurt, I
Sure.
know one of the things that you're in doing is putting together this organization, the peer support network, and really, as you mentioned earlier, of thinking about how can a person kind of make a not I guess it's fair to say a career out of it, of being a peer
Mm-hmm.
support specialist. And I know you've put a lot of thought into that. Do you mind sharing some of your ideas about how that can happen? I mean, just giving with, how people
Yeah.
get paid and all of that sort of thing.
Yeah. So one thing that I did, because like I said, I mentioned at the beginning, I'm very passionate about peer support. And if I could just do that, and not have to, didn't have to pursue a graduate degree or another graduate degree to provide those, well, basically earn an income where I could support my family. I couldn't do that just being a peer. So I founded an organization called the Peer Network. It's thepeernetwork.com. And really, that was the goal in mind, was to provide a platform, which we built a platform from the ground up where we could empower certified peer support specialists to provide their services outside of traditional like clinical settings, like intensive outpatient programs, residential inpatient programs, because that's primarily where they're at right now in community
Mm-hmm.
health organizations. And so I built that, and kind of built a team around, from all over the country, really, from nationally certified peers that are kind of leaders in their communities to bring this service outside of those settings, because I think there is a tremendous value. And even as an adjunct resource for therapists, right? Maybe their clients are struggling with substance use or mental health, and maybe they're just not getting the traction, or they need additional support. Talking to a peer is a great additional resource
Mm-hmm.
that's not meant to replace clinical therapy.
Mm-hmm.
So really what we did, we actually partnered with some big technology companies where we really made this streamlined platform where peers can provide their services. We're a small team right now, but can provide their services via telehealth, and off ultimately provide them a living wage. Because what we did, we
Mm-hmm.
kind of eliminated a lot of the overhead you see in community health organizations or other inpatient residential facilities, where there's a lot of roles such as administration and things like that that maybe don't generate revenue, so
Mm-hmm.
they have to pay the peers less because there's a lot more overhead. So we kind of eliminated that and leveraged technology to provide those services virtually, and pay the peers a living wage so they can support themselves, their
Mm-hmm.
family, and also grow with our organization. So provide opportunities to kind of grow as the business grows.
Mm-hmm.
The main benefit of what we do, I think, is consistency. So there's a lot of like crisis hotlines or places you can call and talk to a peer over the phone, things like that. But you don't really ever know who you're talking to, and you don't really talk to the same person. And we're not a crisis line, where that's not what we are. Those things do come up,
Mm-hmm.
but we provide an opportunity for individuals or family members who are seeking support the opportunity to meet with the same peer consistently to develop that relationship, just like a therapeutic relationship
Mm-hmm.
and clinical therapy. We provide that to them because
Yeah.
our peers are there, and they're there all the time, or whenever you can schedule with them and meet with the same one over and over. And if, just like in therapy, if it's not a good fit, we make sure that another peer on our team can meet with you and provide the service you needed, if that makes
Awesome.
sense.
Yeah.
Yeah.
So is it like a membership that somebody in recovery would join? Is that kind of how it works?
So we don't have a membership, like a monthly membership, and that may be something we do down the road. But right now it's just simply pay as you go. So you can
Okay.
just pay each time you want to meet with a peer. We are working with some insurance companies now, and we're in that process where those would hopefully fall within network for them. But it's a lot cheaper than clinical intervention, and as I said, we're not trying to replace that.
Mhm.
But you can meet a peer for a 50-minute session and it's $60. That's, to me, that's very reasonable. A 30-minute session's $30. So it's a great way for people to get an extra level of support without being committed to, maybe they're on the fence and they're not ready to make a commitment to seeing someone consistently or paying a monthly fee, so they can just pay as they go, and they only pay as they need the service.
Right. Well, it's a brilliant idea, and I'm so glad that you're putting the kind of the muscle behind it, so to speak, or taking this on, because it's something, having various people in my life that have struggled with addiction, it's much needed. And I think, again, having a peer kind of ends some of the stigma that people face. And I think, it gives, like we said already, just a lot of credibility around that. So, well, Kurt,
I think,
go ahead. Mm-hmm.
No, I think you nailed it, Gordon. I think the removing the stigma around it's the key, because a lot of people, it's there's a lot of stigma around clinical intervention, and there shouldn't be, but there is. And, this is often a good first step for people. Maybe they're on the fence about, where they go from here, or maybe they're just struggling, or even family members who have a loved one that's struggling. Talking to a peer can be beneficial, and there's no judgment. We've all been there and kind of done that, and we get it. So
it makes perfect sense. It really does. Well, Kurt, I've got to be respectful of your time, and I'm so glad we had this conversation. Tell folks how they can get in touch with you and find out more and that sort of thing.
Sure. So you can get in touch with us. The best way is thepeernetwork.com. There, you can contact us through there. You can also contact me. My contact info is Kurt Schmidt, so my first and last name, at thepeernetwork.com. Yeah, and for any listeners, Gordon, I know a lot of therapists listen to this podcast. If you think that your clients would benefit from talking to a peer, I'm happy to discuss with you what that looks like and if it would be a good fit, or if anyone just has questions about how to go about becoming a peer. I can try to point them in the right direction or connect them with resources in their community. So
awesome. And we'll be sure to have links in the show notes and the show summary so people can connect easily. Well, Kurt, I'm so glad we got to connect here and have you on the podcast, and I hope to have you back again before too terribly long. Well, again, a big thanks to Kurt for joining me on this particular episode. I'm really excited about the Peer Network, and I think that what he has put together is something that is very much needed and really is going to help people connect in a different way with the help that they need around recovery. And, I think he's just done a wonderful job with the platform he's put together. He's put a lot of thought behind it. And in getting to know Kurt, as I've gotten to know him in the last several weeks, he's very much pays attention to the details. And that's going to be a a big plus of this whole platform that he's put together. And also just happy that he is now one of the sponsors of the Sightcraft Network, of which this podcast is a member. And so, so you're going to be hearing more about this, but be sure and check it out. It's just go to thepeernetwork.com. And of course, there'll be links here in the show notes and the show summary. And again, thanks, Kurt, for being on this particular episode. And also, before we go, I'd love for you to go and check out the two things I mentioned at the beginning of this episode, and that is the Jot form, which we're going to have Morgan Zients here on the podcast here in a couple of weeks. But Jotform is one of those great platforms, and I've been using it more and more, that'll just help you create very rich forms and ways for you to connect with people online. And so be sure and check it out. You can go to practiceoftherapy.com/Jotform. And as I mentioned, they are having a 50% off sale right now for Black Friday from now until November 27th. So be sure and check it out. practiceoftherapy.com/Jotform. And also be sure and check out my friend Ashley's online store, Mental Health Wear. And it's, if you can go to you can go to practiceoftherapy.com/mental health wear. Actually, the full URL for the store is mentalhealthweartn.com. But either way, we'll get you there. And from now until the end of November, you can get 20% off anything in the store. And if there's anything that you want to have customized or tweaked a little bit or have your own design, she can help you with that and get it out to you. So be sure and check it out. practiceoftherapy.com/mental health wear. And also a big thanks to our sponsor of the podcast, TherapyNotes. They are the leading electronic health record system for mental health providers. They're who I use in my practice. Couldn't survive without them. So be sure and check them out. practiceoftherapy.com/therapynotes. And be sure and use that promo code, just Gordon, Gordon, to try them out for 2 months for free. I don't think you'll be disappointed. They are well worth the investment. So be sure and check them out. Well, that brings this episode to a close. And thanks, folks, for being on this journey with me. And happy Thanksgiving, happy holidays if you're celebrating, and be safe in your travels. I know that a lot of you might be, as you're turning on this particular episode, might be traveling. So be careful in your travels and stay safe. And we'll be back with you again next week for another episode of the Practice of Therapy podcast. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the Sightcraft network of podcasts. You can find out more about the other great podcasts in the network by visiting sightcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.